Welcome to season 2 of the Energy Upgrade podcast. I'm your host, Vanessa, master biohacker and successful entrepreneur. In season 1 of the Energy Upgrade, you got to have a taste for my obsession in all things health, energy, entrepreneurship, spirituality, and biohacking, or how to take radical responsibility in living a life by design. As a certified health coach, integrated health practitioner, kinesiologist, and seasoned entrepreneur who built and sold a 7-figure business, I want to dive deeper in this season 2. After healing myself from burnout, from my health falling apart, my hormones leaving my body, I'm here to share everything I wish someone had told me. Every day, I have the incredible opportunity to be mentoring women and supporting them in becoming true magnetic energy bombs. I'm helping them remember who they were all along. It's so powerful that I want to take you in on the journey, almost as if you were a fly on the wall. You'll find that I'm not your typical health coach, and I'm not your typical business coach either. I'm somewhere in between with a lot of spirituality sprinkled in there. This podcast is a sacred place where I come and share with you things that will bring you a high return on investment, because yes, I'm all about ROI. Life goes fast, and if I can show you a shortcut or two, I'll have succeeded at bringing you value. Thank you for being here. Let's go.
Your time is now. Your energy is your life force. You want to be able to magnetize your wellness dreams. A liver detox is the fastest way to start healing. You can and you will.
Welcome back to another episode of the Energy Upgrade. This is Vanessa, your host, and today I have a special guest with me. I'm so pleased to be welcoming Dr. Lucija, who is joining us from Croatia. Thank you so much for being here.
Thank you for having me on the show.
Of course. So you are with GlycanAge, a company that really piqued my interest for the first time earlier this year when I went to the biohacking conference in Orlando, and I got to meet people in your team there. And I was really, really intrigued, I have to say, about what GlycanAge was and what this test was all about. And so, of course, I had to do it myself to have a real experience. And so I was really blown away by what came back. And so I wanted to get you here on the show so you could explain what this wellness test is all about. And really, essentially, for those of you listening, GlycanAge is a wellness test that allows us to basically have an idea of your biological age. So we all know our chronological age, but the idea here is to see, okay, what is our rate of aging, if we will? And usually in the past, I've always used, and I still use, a DNA-based test for that assessment. But I have to say, what came back was really, really, really interesting. So first off, how did you come across these glycans? Tell us a little bit more about you.
Okay, so yeah, thank you for a nice introduction. I think you really brought up the main points about what is it that we do. So I am a medical doctor by background. I worked in medicine for a couple of years when I was living back in the UK. And I think, as I guess many people anywhere across the globe, I became quite frustrated with the healthcare system as it is. And I wanted to experience something else and basically learn a bit more about research that allows us to make some decision in hospital medicine. So I came in touch with our CEO, Nicolina, and our co-founder, Professor Lautz, who is a renowned professor of glycobiology. And yes, this is how my GlycanAge journey really started. I have been with the team for about 15 months now, and I do some lab work researching glycans, and we can talk about that if you want as well. But I do most of the work for GlycanAge, talking about results, interpretation with different clients and partners, and also working on a sort of product development as well.
Mm-hmm. Yeah, I absolutely want to dive into this world of glycans. So can you give us, and we're going to try to keep this because I know this can get very scientific very quickly, and I don't want to lose anybody, but essentially, what are glycans and why does it matter when we're trying to assess our rate of aging or in our inflammation in our body?
Yeah. So I think the simplest way to put it would be to say that the glycans are sugars. So not the sugars that you necessarily eat, not the kind of sugar that you get from your food, especially overly processed sugar, but the sugar that your body makes. And that's vital, really, not just optional, but vital in how your cells and tissues work. So you can find glycans in many different places. So if we kind of go down to the level of cells, your cells will have glycans on them, but also all different proteins and lipid molecules, even RNA. And so the story of GlycanAge did start with the lab, and the lab is still ongoing. Back 20 years ago, and with the knowledge that we gained over the years, we realized that glycans that code one protein, in specifically, this is one of your antibodies. Those glycans tend to be involved in how inflammation is produced and whether it is produced or not. And that really is the basis of our test of biological age.
Mm-hmm. Okay, so let's dive a bit more into this because, okay, so these glycans are sugar molecules that are essential in the body. And so from what you've researched and seen, they have impact on a lot of things, inflammation, immunity, response, even disease formation, all these things.
Yeah, exactly.
So how, tell us more about that.
Okay, so glycans, as I said, exist on top of cells, and they are very important in making cells talk to one another. Obviously, for any relationship to be going strong many months and years, you have to have good communication, and this is what our cells have. And in many ways, they use glycans to do that. But our research really in our lab has mainly focused on glycans that are attached to different proteins. And one protein is, specifically, that's immunoglobulin G, that many people have heard about in the context of immunity, autoimmunity, even infections. And what we've seen is that depending on what kind of glycans you find on that immunoglobulin G protein, your body will either react to a certain trigger with, by, basically producing inflammation or suppressing it. And that sort of tells us about, what the inflammation levels are in the body, but it also tells us about how your body is able to protect itself against, toxins and pathogens and microplastics and, different diseases, but also how well it is able to respond to some of these triggers when it needs to, when it has to actually produce inflammation. And I think this is very important because when people hear about the term inflammation, they always think, that's something negative. It is good. It's a necessary thing when you are exposed to, say, a virus. If you have a bug or a viral infection, you want your body to be able to produce that inflammation. But if that inflammation is ongoing after you clear out that virus or a bug, then that's where the issue starts, and that can then lead to, potentially you developing a disease. So we really measure that. We measure those glycans, so we analyze glycans on that antibody, on that immunoglobulin G, and that, gives us basically an answer as to how much is, systemic inflammation you have.
Mm-hmm. That's why in the report, so this is a very easy test. It's really just a little prick on the finger. You send a little drop of blood essentially, and you send it back to the lab, which we were just discussing offline currently is in Croatia. But it's great because in the box, you already receive an envelope that's already stamped, and it's very, very seamless. But you were saying maybe new labs are going to be added, perhaps in the US.
Hopefully, yeah. Fingers crossed.
Exactly. But so, and then you wait a few weeks and you get your result. And I was really blown away by mine. But I just maybe want to add to what you were just saying about the inflammation is in the report. It was really interesting to me that you have anti-inflammatory indexes and you have pro-inflammatory indexes. So that's what you're referring to.
Yes, so that's what I was, maybe I wasn't quite clear in that. But when I said, depending on what kind of glycans you have that code this immunoglobulin G, and by that I meant actually, what's the proportion of the good glycans, you can say, the anti-inflammatory glycans, and I think what we call in the report the pro-inflammatory, so the glycans that promote inflammation.
Yeah.
So basically, the relationship, the proportion between these two is something that will determine what your GlycanAge is, and will basically tell us how much of that inflammation you have in the system.
Mm-hmm. Yeah, it's so interesting. And maybe let's talk about how looking at these glycans or measuring their activity compares to looking at DNA expression, which is usually the most common method out there known to measure the rate of aging or inflammation.
So, you are right. And I think I would say it makes our job and, the job of many different biological age and test companies a bit difficult because there are so many tests out there. And I think another factor that makes it difficult maybe for your consumers or any consumers to know which test to choose is that they all kind of sound similar, but they all really do measure different things. And this is possible because biological age doesn't have a strict definition. It doesn't, you're not defined by saying this is what it is or this is what it's not. So the way we are, we at GlycanAge, the way our test is different is that obviously we do not look at the level, we do not basically measure or analyze DNA. We measure, you can say, the byproduct of what's in the genes, but also the byproduct of how that then corresponds to your environment. So because we are, as in a way, an epigenetic test. So we combine the GlycanAge you get is a combination of information, yes, from your DNA, but also a lot of it has to do with natural passage of time, because we know glycans change as we age, which is inevitable. But there is, another very important factor, which is lifestyle and environment. And obviously, yes, DNA, if we're talking about, other sort of changes such as DNA methylation, which is what some other tests measure, yes, that can also tell you a bit about lifestyle. But we really are, and this is not something that we are saying that comes from our mouth, but there was a really recently published paper in one of the, the most important journals in sort of this area of science that basically put us at the top as a test that is the only one that is able to measure the effectiveness of lifestyle interventions.
Mm-hmm.
So you won't see that with the majority of DNA methylation tests. Yes, to some extent, but really we are the only ones that are able to give you that feedback if that's what you want, right? So obviously people do these tests for different reasons.
Yeah, I definitely use these tests especially in my biohacking coaching program, because it allows me, and I usually do them halfway through, to see all the things that we've been putting in place, lifestyle related, are they having the impact that we're wanting? Are we moving in the right direction? And those tests, would you recommend it's something you could do every 6 months or every year? Like, what's the ideal frequency?
Yeah, that's a good question. So with GlycanAge, so I think if we go back to your example, and we don't have to talk about your results specifically, but
we
say
will.
it's
Yeah.
we will, okay. But so Thunderdam, you'll get to know that Vanessa's result was amazing. So in case like that, where you might simply want to monitor your health, you're not necessarily changing anything upside down, but you just want to see where you are in terms of inflammation level, then once a year testing is something that we would recommend. if you are, for example, if you yourself, Vanessa, are working with clients who are keen to change a specific thing, I don't know, they might want to change their approach to diets and food, or they might want to think about taking a new supplement they haven't been taking so far, then it will depend on what kind of an intervention that is. With some interventions, such as supplements, medications, we see the effects already at about 3 months into sort of starting that therapy or supplements. Whereas with what I call softer lifestyle changes, such as dietary change, we're looking at about 3, but more 6 months of persisting with that change before it actually pays off, to retest, because you would want to be able to capture the changes. So doing it a bit too early, you're kind of risking that you might not actually capture that. So with sort of diets, say, exercise changes 3 to 6 months.
And that just makes me think. So if we go back to these glycans, these sugar molecules, how long does it take for them to be produced or not produced when we make those changes? Like, is it pretty fast?
What do you think? Do you think it's on a daily basis? Do you think it's on a weekly basis? Just like, I don't know, just a guess.
I would think it's an immediate response, but I don't know.
No, it's actually not. So I think this is very important to know in terms of knowing when to retest. So if you take the test today and say you take it in 5 days, it should really be the same. So glycans don't change on a daily basis. They change more on a weekly to monthly basis.
Okay.
And the reason behind that is, again, the turnover time of that immunoglobulin gene. So, scientists and researchers and clinicians like to talk about half-life, but if you kind of translate that into more of a normal term, then you really need around 4 to 6 weeks for your, glycans and IgG to kind of fully change if there is an input that's changing. So if you are changing, something drastically in your lifestyle, this is where you'll first notice the change after 4 to 6 weeks. But that change has to actually be consistent for some time. And this is why we kind of say 3 to 6 months to give you an estimate before it then pays off to retest. Okay. So yes, definitely not changing on a daily basis.
Okay. Yeah, that's interesting. It makes sense. I guess I was thinking about the inflammation and the impact of that, but and I guess it starts compounding immediately,
exactly,
right?
exactly. So I think important here to say is that, and this is a question we get quite often, is what happens. So say you test on a day where you're not feeling okay, you're not 100%. You might be developing some mild viral infection. That's not going to affect your result. Okay, so you need to really be, chronically sick and ill for weeks and months, before that's something that's reflected on your GlycanAge, which in a way is good, because we don't capture such changes, but we really give you. So your GlycanAge gives you an insight into, okay, how have you been living and looking after yourself? How has your health been over the past 3 to 6 months before you took the test? That's what GlycanAge is.
Got it.
Really
and
about.
To me, that's where the difference is with the DNA test. What if I told you that it's time to get crystal clear on what you are not bringing over with you in 2024? What if we could ditch the people pleasing and take a moment to really recenter on you? What if we could discover what you are intuitively called towards? And what if we could set a clear, magnificent vision for this year ahead so that whatever you're ready to manifest can actually happen through clarity, through intuition, through the frequency of abundance and expansion, those dreams that you've been putting on pause. It's time to pick them back up, and 2024 is going to be magical. Now, I've created Biohack Your 2024. This is a powerful event that will be happening during the holidays while things are a little bit more quiet. A perfect time to go inwards. I will let you in on my own end and beginning of year rituals. And this will happen through 2 powerful 2-hour masterclasses that will be delivered on December 28th and January 4th. The replays will be available, but in this time together, we will co-create your vision for the new year. We will be crystal clear on how you want to feel and what you're ready to call in. And through powerful activations and the workbook of a lifetime, my friends, I'm so excited for that. I will be supporting you in this powerful vortex of transformation. 2 powerful 2-hour sessions for $224 for 2024. We're really calling in big magic. And so if you're interested in joining this vortex, there's already so many women signed up, and I can already feel how potent this is going to be. Now, I hope you're able to join us. If you're interested to read more about Biohack Your 2024, or if you want to save your spot right now, the link will be in the show note. Now, let's make 2024 the year of your dreams. I hope to see you there. So maybe we can talk about my experience, because I did both tests within about 2 months apart. So my DNA test came back not great. Not great. It wasn't a disaster, but so let's say at the time when I did it, I was 38, and it came back that my biological age was 41. And I was really disappointed, because I'm, obviously I live such a clean lifestyle, and, I really practice what I preach. And I was so I was really sad. I'm like, oh my gosh. But then after digging and reading, I know I don't have good genes. I know I also have the MTHFR gene mutation. And so I know that I don't have a good genetic makeup to begin with. So I've always, all my life, I've been up against that. And that's why I've been so proactive early on to really take my lifestyle seriously and be really careful about the kind of supplements I'm taking to help the epigenetic part, right? Which having genes is one thing, having them is one thing, but activating them is the other thing. And that's really what matters. But I feel like this DNA test, and correct me if I'm wrong, was mainly focused on my genetic makeup.
Yes. And I mean, I think you are right in saying that if you want to get feedback on the lifestyle side of things, then that is likely not the best choice, to go for a test like that. I think every test out there, talking about biological age tests or any other health data you can have from traditional blood tests, vitamin level, mineral levels, like even sort of, genotyping. So tests like 23andMe, Ancestry, and so on. All of that can give you some information, but you have to all of these are components of one big puzzle. And, I think if somebody is looking to know a bit about how they're aging in terms of inflammation, then they will choose our test. If they want to get a bit of a feedback on lifestyle, they'll choose our test. If they want to know a bit about DNA methylation, they will choose such a test. Exactly. But I think it's about using as much different of those different metrics you have and making sense of that. Because currently, and maybe one day, probably not so far from now, given what AI is doing, we'll be able to combine all of that, all of the data from all the different platforms and tests to kind of have a better maybe
interpretation.
Interpretation or sort of general guideline. But if you're talking about aging, and and we are talking about aging because we do measure systemic inflammation. Aging is a complex thing. It's not just inflammation. It's many other things that start to go wrong at a certain age and continue. And I think we still have very low knowledge really of what aging actually involves. But yes, to kind of expect that it will only be one number, I think that's just not realistic.
Yeah. I appreciate that, because so while this DNA test, while I was disappointed, it also was very informative to confirm, okay, yes, I have these methylation pathways, and this is something I need to be careful about. Now, but what was interesting is with your test, which is more, I guess, wellness or lifestyle based, measuring the impact of some of the modalities we decide or some of the protocols, I on purpose decided to do your test after a 7-day liver detox, which is the detox I recommend all my clients to do every season. And I thought, okay, well, I have this measure here on one side, which is my DNA test. And so let's see what this gives me. And the results were just mind blowing. It came back at 20 years old, which I loved. I love those results. But all joking aside, it was really interesting to see the inflammation markers, the anti-inflammation markers were really high, which you're calling the glycan youth and the glycan shield, which means basically those are pro anti-aging, if you will, or the youth
in a way. Yeah.
And the shield one is really what protects you against chronic inflammation, is my understanding.
Mm-hmm.
And then my pro-inflammatory, which you're calling glycan mature, which is, I guess, aging you faster, was really low.
Yeah. No, I mean, I think you have you did all the explanation yourself. I don't have to add much, which makes my job easier. But yes, so I think just to kind of clear it up for your listeners. So yes, so we talk about, GlycanAge, obviously we give you a number which represents your biological age in the report, but we like to dig deep. So we tell you a bit about, so what I said just earlier, talking about the good glycans, the anti-inflammatory and the pro-inflammatory, and we have these funny names that we kind of assign to them. They all have, a reason why. So youth that you mentioned is one of those good glycans, because we know that when we are chronologically young and healthy, we tend to have a lot of these glycans, which kind of explains the name. Mature, on the other hand side, which is a pro-inflammatory glycan, tends to creep up as we age. So you see that glycans kind of, they all sort of different glycan structures, they communicate with one another, you can say, and one might be going up as you age, one might be going down, and those are the patterns that we see in all people, irrespective of sort of racial background, or where they live, or even what kind of lifestyle they have. So there are some things that are kind of the same for all of us, and this is something that's also reflected in glycans.
Mm-hmm. Yeah, it's so interesting. And then you have supportive ones, which you're calling the glycan lifestyle, which I guess is a representation of, maybe you can expand on that, the glycan lifestyle.
So there are 2 additional numbers that are not part of the GlycanAge calculation, which is why we call them supportive. So one of them is lifestyle. And this is where it gets really tricky, because when our customers see that, they think it's all of their lifestyle that associates with this specific number. But this will mainly be your diet, so the quality of food, if we're talking about sort of whole unprocessed food versus ultra processed food, which we obviously know it's bad for us, period. And also things like sleep, stress, if these things are imbalanced, then glycan lifestyle will tend to suffer. And then there's another supportive that we call median, which is heavily influenced by genetic makeup. And interestingly, and I think, might be something that your listeners might find interesting. So with this median index, we have done one study where we looked at women only, and we saw that index and another glycan structure that makes it basically can help us understand somebody's risk of cardiovascular events. So mainly heart attack and stroke as well. So this is just kind of to illustrate that the glycans can give us another layer of information on sort of, not just this is the lifestyle intervention and this is if it's good or bad for you, but actually they might be even able to tell us how they associate with certain medical conditions. And in some cases, they even have a predictive power, which is something very important to know.
And is that one of your goal in the company? Because as you're collecting more data points, are you trying to really be able to get more precision on that?
Yeah, absolutely. So so we're now expanding the report. So obviously we didn't show you here the report, but the report itself is what our clients and different partner clinics can see, and different, we'll partner with different functional medicine clinics, longevity clinics, different health coaches. And the report you saw is the one that is currently available. But what we are trying to now do, and we're upgrading it by providing how different glycans associate with different diseases. So basically giving like a glycan fingerprint, and matching that to all the studies and the research we've done, and basically telling our partners, in the form of written report as to what might be the diseases they might need to look into or screen their patients or clients for, especially in the case of a GlycanAge, which is not good. And I think that's very helpful. I mean, the partners definitely find that helpful. Because one thing is to have a completely healthy person that you're working with, but what if somebody's already kind of in that category of having chronic disease? You want to know how to be able to manage them better, or if they might be at risk of a certain condition, to actually understand that might be at risk. So this is kind of, you can say that, yes, we are sort of we still are, and we will not be diagnostic tests, but we want to kind of provides our partners and clients with the information that we have from the research studies. And they show that, yes, glycans, apart from the lifestyle interventions and telling us what to do or what not to do, they can help us, maybe screen some people for predisposition to certain diseases.
Have you been able to find so far a link between glycans, like some glycans and cancer? Like, are you able to have early detection through that?
So cancer is really difficult. Cancer is even, when we say cancer, we just know it's C word you shouldn't say. But actually, if you look at different types of cancer, they're all very different when it comes to different glycan structures. So it's difficult to kind of put all of these different types and call them cancer and say this is how glycans change. So cancer has been quite tricky, and this is, I would say, if you think about all different types of diseases out there, probably that's the category of disease that we have explored the least so far. We have, from our, there are some other labs that do glycan research, but in our lab, we've mostly looked at colorectal cancer, and we have some data there, even some possibility of using the glycan data to be able to predict certain stages of that disease. And some data on some sort of women's health cancers, so ovarian and endometrial cancer. But all the other cancers still a bit, still have some more work to do.
Wow. Yeah, because how great would it be, instead of maybe now having to invest into these full body MRIs or scans, to have early detection? And that would be great.
Yeah. You would want something that's non-invasive, that's not as expensive, that's kind of like a very good biomarker of something. And I think this is where medicine is going, and this is where we as a company would want to go as well, and I hope we are going. Yes, to be able to show that from the data and the research that we do and have done, that we can use that to sort of help make the right biomarkers informative ones.
And just quickly, I know in the report you talk about menopause, perimenopause. So are you finding that hormone levels or those stages of life also have an impact on glycans?
Absolutely. So this is one really fascinating area of research. So what we're finding, so just to sort of, I guess, summarize what we know about that, is that hormonal levels of, hormones of any kind, especially sex hormones and especially estrogen, they make a big difference when it comes to glycans. So if you have enough of estrogen, which when you have your regular cycle, you should have, that favors a status of controlled inflammation. But what happens in perimenopause and then when menopause comes is that obviously unless you're taking some estrogen from outside, so unless you are going on hormone replacement therapy, your body's sort of storage and of that hormone basically goes down, and that pushes GlycanAge up. So basically what that means is that lack of estrogen causes women to go into that sort of accelerated aging transition, which is obviously very important when it comes to inflammation because it pushes inflammation up. But now we know, in the last sort of 10-15 years of research, how important those hormones are, not just about, not just when it comes to some of those maybe menopausal symptoms, but all the other symptoms that women can experience and maybe that can predispose them to certain chronic conditions. So yes, there is a link between how glycans change and how GlycanAge changes when it comes to these
And
conditions.
so where would that be shown? Would that be shown in the glycan mature, which is the pro-inflammatory? So let's say
So
someone
youth
is,
and mature, yeah.
oh, okay. So you would see, because let's say someone is suspecting they're going through perimenopause. I have a lot of clients there. How would that relate in that, like to confirm that this is indeed happening inside their body? How would we be able to do this? We'd be able to
Yeah,
see.
so it is difficult to be able to gauge that on a one-off test result, simply because perimenopause, as you might know, is a very challenging period, right? So you
Yeah.
have hormones going up and down and up and down, and in accordance to that, women tend to experience different symptoms or no symptoms. It really varies. So say somebody comes to you and they test your GlycanAge first time round, you know them, you know what their lifestyle is like, and then they repeat the test, say in 6 months, and you see that GlycanAge has gone up, but everything else has really stayed the same. They're still, healthy, they haven't changed anything in their lifestyle. Maybe they have more or more severe perimenopausal symptoms, then that's a piece of information you can use to say, okay, yes, it seems like you are maybe progressing through that transition to be closer to menopause. So that's something like an indication, but based on a one-off test result, it is difficult to know because somebody's GlycanAge can be high or can be increase for many different reasons. And also, I think it really also depends where you catch, a woman in her cycle and this sort of, period of hormone oscillation. So yes, I think in those cases, it is definitely good to have at least 2 data points. And we have done that. So we have been tracking quite a few of our female clients throughout, the years and months, and seeing how sort of GlycanAge basically just keeps going up and maybe at some point kind of jumps out of nowhere. And that kind of gives us then more confidence to say, look, this really is, you're kind of very near menopause. This is it. Maybe think about, how you would want to approach that. So yes, as many data points as possible helps.
Yeah. And of course, maybe pairing that with an actual full hormone panel, right? Then
Absolutely.
that would be really,
absolutely. Yeah,
it would be a great
absolutely.
way.
I mean, great way. Hormone. Yes. I mean, yeah, I kind of, I didn't think to sort of, put an accent on that, but absolutely. I mean, having hormone levels help, knowing your patients or your clients help, and I think having time to listen to them. And I think this is what really is challenging in perimenopause and menopause, because when you go see your family physician, they don't have time to hear,
Yeah.
to hear you talk about things. Maybe they will think it's something else, but it's not. So I think it's history taking, knowing your, patient's client story well, and doing, tests. Yes,
Yes.
hormone levels, making sure everything else is fine. And yeah, I think GlycanAge can definitely help there.
Mhm. And that's why having tests like yours, actually, it matters to help. I'm speaking to women in particular, but anybody taking control of their health, right? And not waiting for their physician. So this is just an extra opportunity to have more data points about what is happening in your body. And so maybe in wrapping up, I'm going to put the link in the show notes if someone is like, ooh, I really want to do this test. So I'll put the link. But you've talked about the cycle, and that just made me think. So is there a preferred time to take the test? I know you said it doesn't really matter. And I guess now me doing it after a 7-day liver detox didn't really change a thing, because we've talked about how it's 3 to 6 months in the making, which is great. Then it means I'm on the right track. But would you consider to prefer doing it at some point during the cycle, or?
Yeah, so I mean, we've done a study to look into that, and when it comes to our test, the GlycanAge test, we're not seeing any differences. Whether you take the test on day 1 or day 15 or day 20 of your cycle. So I wouldn't worry about that. I think it's what people normally don't worry about, which is those 3 to 6 months before taking the test. But I think to say, to even share my personal experience of testing myself, and just having that information as an input is to kind of assess what's going on. I think it's a good question of, what are you doing in your life? Are you looking after yourself? What are the things you're kind of struggling with? What is it that you might want to change? Is there something to change? And also, as a way of what you said, taking the power of knowing yourself back to your own hands. And I think that's about sort of being a responsible adult. But also, I think in this day and age, knowing what the healthcare systems look like, they're all struggling very much. And if we are to live longer lives, and we are currently living longer than 50, 60, 100 years ago, to be able to be functional people until the very, very old age, I think it really takes a lot of investment in health. So it's not about, I'm going to do something today, I'm going to expect results tomorrow, but actually doing things now, the next 3 to 6 months. And I think using this test as a motivation to know, I'm doing well, well done me, or I'm not doing well, I want to be doing better, let me find someone who could help me do that. And I think that's super important.
Yeah, thank you for mentioning that. We're aligned. We are aligned. Well, thank you so much for coming here to have this conversation, to shed light on these glycans. And I think we're going to hear more and more about them. I think it's very innovative what you guys are doing. The test is fascinating. And I will link everything about you and the company and how they can find you in the show notes. Anything else you'd like to mention in closing?
Yeah, I mean, follow us in social media. We're very active on Instagram, and we post a lot of good stuff, latest research, not just related, but many different things. And we also bring inspirational, people to interview them and talk to them. And I think it's a nice and healthy community. But yes, I would just say thank you for having me on the show. And yeah, I hope that we can use, the power and all the data that we have to make a difference.
Yeah. Thank you. Thank you for everything you're doing. Thank you for your time here. And thank you to you listening. I hope that this was helpful. Maybe you're now even more overwhelmed, but again, just see this as another option, another opportunity to have data points on your body. And if at any point you feel overwhelmed, that's when you reach out to all the different types of practitioners, functional medicine physicians, health coaches. We're there to support you on that journey. Thank you again, and we'll see you next week. The information shared on this podcast is for information purposes only and doesn't provide any medical advice. Vanessa Grutman does not cure, diagnose, or treat disease. Please consult your physician before trying any new protocol or product.